Welcome everyone to the sixth meeting of the Senate Standing Committee on Families and Children. Do we have any member that needs to introduce a guest? Seeing none, if the Secretary would please call the roll.
Senator Girdler, Senator Harper Angel, Senator Bledsoe, Senator Meredith, Senator Tishner, Senator Webb, Senator Westerfield, Senator Wise, Vice Chair Rocky Adams, Chairman Carroll.
Here. We have 5 items on the agenda today. We're going to need to move quickly. I would remind everyone to please silence your phones, and we are going to go in order this morning. So the first bill will be House Bill 165, an act related to employee child care assistance, sponsored by Representative Nick Wilson. Representative, please take the table. And when everyone gets seated, please introduce yourself for the record, and you all will have the floor.
Good morning. I'm Representative Nick Wilson from 82nd District, Whitley County and Laurel County, and it's a pleasure to be here. I've not had the opportunity to meet many of you yet, so thank you for having us. And I have 2 guests. They're here really just in case any questions pop up, but I'll have them introduce themselves.
I'm Mandy Marler, Chief Policy Officer with Metro United Way and Lead Advocate for United Way of Kentucky.
Charles All, Kentucky Chamber of Commerce.
Thank you, Mr. Chairman. So this bill is House Bill 165. It makes 2 changes to a program that was passed last year in House Bill 499. And what that program did was basically just above the poverty line, there's a state employer match to provide help with daycare costs to employees. So say if the employer provides $300 a month, then the state can match that, and there's $600 a month going towards the employees' child care costs.
We have a motion on the bill. Are there any questions? Do have a second? We have a motion and a second. Secretary, please call the roll.
Senator Rocky Adams, Senator Girdler, Senator Harper Angel, Senator Bledsoe, Senator Meredith, Senator Tishner, Senator Webb, Senator Westerfield, Senator Wise, Chairman Carroll.
Aye. Okay, on a count of 7-0, bill passes with favorable expression. I have a motion for consent. Is there a second? All those in favor, please signify by saying aye. Opposed, no. Motion carries. Bill will go to the consent agenda. Representative Wilson, congratulations, sir.
Thank you very much, Mr. Chairman.
Next item on the agenda is House Bill 238, an act related to anatomical gift discrimination. Representative Wade Williams. Good morning, Representative Williams. Please introduce yourself for the record as with your guest, and you will have the floor.
Thank you, Mr. Chairman and members of the committee. My name is Wade Williams. I'm the district representative of District 4 of Hopkins County, and I'd like for my guest to introduce himself, please.
My name is Morgan Elliston.
My name is Philip Elliston.
Good morning, Mr. Chairman. And what I want to talk to you about today is House Bill 238. And this bill is about medical procedure discrimination. 4 states have passed this law, and others are pending as we meet today. Individuals with disabilities routinely face discrimination in health care, from consultants to referrals, all the way to determination of eligibility, placements on waiting lists. Often this discrimination is subtle, based on quiet assumptions, like out-of-date but very still prevalent assumptions about the quality of life with someone with Down syndrome, for instance. House Bill 238 also directs healthcare workers, healthcare providers to consider an individual's personal care support when making determinations regarding organ donations. There's a remedy for this bill: individuals who believe they have been discriminated against, but it is limited to injunctive relief. Now, I'd like for my guest to tell their story, please.
Committee Chair, members of the committee, and Representative Williams, thank you for the opportunity to speak here today. My husband, my daughter, Quinn, and myself are residents of Frankfort, Kentucky. Quinn is 11 years old. She has a contagious smile, unmatched determination, and strength beyond measure. She's the absolute center of our universe. Shortly after Quinn turned 1, she was diagnosed with Wolff-Hirschhorn syndrome. This syndrome affects 1 in 50,000 individuals, and due to various medical complexities, 1 in 3 children do not survive until the age of 2. This particular rare disease has affected her in many ways, including severe growth and intellectual disability, chronic kidney disease, and epilepsy. While I'm grateful for the advancement in medical technology, which allows individuals like Quinn to survive and thrive, I'm also very concerned about what the future will hold for her. Her kidneys are currently functioning at 30%. The chances are slim that we will not have to pursue a kidney transplant in her future. All across the Commonwealth, individuals like Quinn may someday need an organ transplant. In its current form, the guidelines for allocation of an organ does not mention protections for individuals with disabilities. And I quote, "Allocation of a deceased donor organ must not be influenced positively or negatively by political influence, national origin, ethnicity, sex, religion, or financial status. No mention of disabilities." In 2012, a child with Wolff-Hirschhorn syndrome was directly affected by this type of discrimination. Her family was told by the Children's Hospital of Philadelphia, which is the number 4 children's hospital in America, that their daughter did not qualify for a kidney transplant because she was, quote, mentally retarded and did not have the quality of life to justify the transplant. The kicker, her mother was her match. It was only after national media attention that this young girl received her transplant. 11 years later, she's thriving. Our family directly understands the impact and importance of organ transplant, as my father-in-law was a kidney recipient in 1981 at the age of 26. Although not impacted with disabilities, he went on to enjoy 29 more years of life before his passing. With the passing of House Bill 238, you will be giving individuals with disabilities the same rights as every other individual that needs a transplant. 37 states have already passed similar legislation to protect individuals with disabilities. It is my hope that we can start the process of protecting every Kentuckian with a yes vote for House Bill 238.
I have a motion. Is there a second? Any questions? Secretary, please call the roll.
Senator Rocky Adams. Senator Girdler. Senator Harper Angel. Senator Bledsoe. Senator Meredith.
Explain my vote, Mr. Chair.
Please proceed.
Thank you for bringing this bill. I vote for this, and appreciate you bringing this issue to our attention. I don't think many people are aware of this. And there was a state back in, I think it's 2012, that passed a policy for some reason that in a situation where we had a shortage of ventilators, that patients with severe mental disabilities would not be considered for placement on the ventilator list. That's just unconscionable. So I appreciate you bringing this to attention and sharing your personal experience. Thank you.
Senator Tishner. Senator Webb. Senator Westerfield. Senator Wise.
Aye.
Chairman Carroll.
Aye. On a vote of 7-0, bill passes with favorable expression. To have a motion for consent. Have a motion and a second. All those in favor, please signify by saying aye. Opposed, no. Motion carries. Representative Williams, ma'am, thank you for being here. On behalf of a father of a child with disabilities and all of those that I serve with disabilities at Eastern Seals, West Kentucky, it's a great bill. Thank you.
Thank you, Mr. Chairman, members of the committee.
Okay, next on the agenda is House Bill 248, an act relating to recovery housing. The sponsor is Representative Samara Heavrin. Representative Heavrin, please introduce yourself for the record and ask your guest to do so, and you have the floor, ma'am.
Thank you so much, Chairman Carroll. My name is Samara Heavrin. I'm the 18th District Kentucky State Representative, and I'll let my guests introduce themselves.
Good morning. My name is Jeff Gregory. I'm Mayor of Elizabethtown.
Good morning, Jeremy Thompson, Elizabethtown Police Chief.
House Bill 248 was brought to me by my mayor and police chief to talk about recovery housing and the need for certification. House Bill 248 represents an agreement among treatment providers and their communities by establishing a certification requirement for recovery residences, sober living homes, or any similar type of drug-free residence for unrelated individuals. These types of operations are not currently regulated under Kentucky law, and the recovery residences covered by this legislation do not include patient housing that is part of a licensed clinical or behavioral treatment provider or homes recognized as part of the Recovery Kentucky program. And so that's the basis, and just because my guests drove a little bit to get here, I'm going to let them speak.
Thank you, Representative Heverin, and I will get right to it because I know you all have a busy day. The meat and potatoes of what we're asking for, what we're looking for is relief when it comes to recovery centers, recovery houses, sober living houses. In the city of Elizabethtown, we have 87 different establishments. Most of them popped up post-COVID, and I want to make sure that I'm clear. A lot of them are very good and do a great job and what they're designed to do, but we also have several that we have determined are bad actors in multiple ways. They're putting a lot of stress on a lot of our resources and a lot of our services there in Elizabethtown, and some of the things that we're seeing we think is a detriment not only to our city but especially to people that have already been victimized once in a lot of ways, and they're coming and they're staying in these recovery houses and they're not getting what should be afforded to them as far as care goes and different things of that nature. But we have a for lack of a better term, a soup kitchen or a day treatment place for the homeless that we call Warm Blessings. And so a lot of these people that have these treatment houses or these recovery centers are sitting there, people that are staying there and paying to be there to this resource for food, and they're taking their EBT cards, and there's just a list of things that are going on as far as the bad actors go in this business. And so we're looking for a regulatory arm or a tool to be able to make sure that people are doing what they're supposed to and they're taking care of these people when a lot of other places won't do that. So that's just a few of the examples. I'll let Chief Thompson talk to you a little bit about the law enforcement side of things.
Good morning again. We certainly want to be respectful of your time, but thank you for this opportunity for being here this morning. Oftentimes in uniform, I think we're looked at as sometimes in the circles of addiction as the bad guys, but I want to begin my comments by saying that I've lived with addiction. I grew up with an addict in my home. I have family members battling addiction to this day, and nothing could be further from the truth. And this is a police versus someone who's battling addiction. What this is, as the mayor and Representative Heverin have already stated, it's an attempt to clean up what we have in our area right now and those bad actors. What we're seeing is a lot of these folks are being literally recruited, these folks that are struggling with addiction, and some of these facilities are going to other states, Alabama, Georgia, Tennessee, and they're finding whether homeless or addicted otherwise, and they're bringing them to Elizabethtown. And what we're seeing is, after a very short time in one of these facilities, that they're either kicked out, there's a problem, and they're put on the streets of Elizabethtown. And then from there, oftentimes a lot of these folks are, they have warrants, they encounter the police, so our services are then required, or there's some type of disturbance at a facility. As the mayor said, the two soup kitchens, food pantries that we have, I've spoken to both of the administrators of those facilities. Each of them in the past year have spent over 48% of their resources on individuals that they have identified as coming from these sober living halfway houses. And they will never turn anyone down, nor do I think they should. But these people are coming to these facilities for help when they're the most vulnerable. They finally have decided, I need help with my addiction. And at their most vulnerable points, they're being taken advantage of. And again, I've lived with this, I've seen this, and God forbid that we support and allow these places to continue to victimize those that have finally reached that tipping point where they say, enough is enough and I want help with my addiction. I want to be clear as well that the police department is not looking to be that arm of accountability for these places. We have plenty to do, I promise you. But someone needs to be able to step in to make sure that there are some standards of care, that these folks are receiving true addiction services. We had 15 fatal overdoses in Elizabethtown in 2022. 1/3 of those had an involvement from a halfway house, either someone who was staying in one, or some of them have peer support that are in the facility. 2 of the members that were involved in these fatal overdoses were actually at one of these facilities, one of which was peer support. Now, I find it hard to believe that a peer support individual that's there to support those battling addiction would be the one bringing this poison into that place and then having a fatal overdose themselves. So I don't know that any type of care is being administered when peer support you're bringing in not only is providing this poison, but then succumbs to a fatal overdose themselves. So again, we thank you for the opportunity just to bring this. I have plenty of examples that I could quote time and time again of the citizens of E-Town being attacked, stolen vehicles that are all directly tied to the bad actors. Again, we are absolutely in support of addiction services for those that need help, for those that are to the end of their rope and they want help, but we need that arm. We need some type of regulatory arm just to make sure that these places are providing the services that they are advertising.
We have a motion and a second. Gene Deathridge, is there anything that you need to add to this conversation? Are you good? Yes, sir. Okay. Madam Secretary, please call the roll.
Senator Rocky Adams. Senator Girdler. Senator Harper Angel. Senator Bledsoe.
Can I spell my vote?
Please proceed.
Thank you. I'm an I vote, but I just want to say how important this legislation is. In Fayette County especially, we have had the same kinds of issues where we need recovery housing. There are neighborhoods, there are important pieces to recovery and long-term health, but the bad actors are significant. And there's been no kind of ability on the side of the community to say, how do we regulate some of these proactively? So I really applaud your efforts and I appreciate the legislation.
Thank you.
Senator Meredith. Aye. Senator Tishner. Aye. Senator Webb. Senator Westerfield. Senator Wise.
Explain my vote, Mr. Chairman.
Please proceed.
Thank you, Mr. Chairman. A representative, excellent piece of legislation. Appreciate the policy. I think every community is dealing with this issue. Chief, thank you for your comments as well. Mayor, thank you for your leadership. I should have asked this as a question earlier, though. With you being here today and not back at City Hall, who is running city government right now back in Elizabethtown? Your absence?
So do you want me to speak her name, or
if you can?
Miss Amy Inman, is that what you're getting at?
I've just tried to make sure we're in good hands back in Elizabethtown with you being here and Miss Inman being in control.
Yes, sir.
Happily vote aye. Thank you, Mr. Chairman.
Chairman Carroll.
Aye. Count is 7-0. Bill passes with favorable expression. I have a motion for consent. Is there a second? We have a motion and a second. All those in favor, please signify by saying aye. Aye. Oppose? Motion carries. House Bill 248 will be put on consent for the purposes of the floor vote. Mayor, Chief, thank you both for being here. Excellent bill. Representative Heverin, thank you for all your efforts on this. Okay, next item on the agenda, House Bill 334, an act relating to intermediate care facilities for individuals with intellectual disabilities. Sponsor Representative D.J. Johnson. Representative Johnson, if you and your guests will please come to the table and introduce yourselves for the record, and you will have the floor, sir.
Thank you, Mr. Chairman. Thank you, members of the committee. My name is DJ Johnson, State Representative for the 13th District, and I would ask my guests to introduce themselves.
I'm Doug Hoyt, Chief Executive Officer of Wendell Foster in Owensboro.
Jason Squire. There you go. That's it. Okay. Jason Squire, Chief Operations Officer at Cedar Lake, based in Louisville. We also have operations in Oldham and Henry counties.
Again, thank you, Mr. Chairman. House Bill 334 makes one very simple change to regulations, but it's an important one. What House Bill 334 does is authorize or make, I guess I want to actually read the language because I think it's important. It creates a new section of KRS Chapter 216B to require an application to increase the number of beds by an intermediate care facility for individuals with an intellectual disability to be consistent with the state health plan under certain conditions. The short answer to that sentence is that currently it's the state health plan does not recognize need for additional beds for intermediate care facilities. These two organizations want to be able to expand their abilities to care for individuals with developmental disabilities, and they need this change in the regulation to do so. Mr. Hoyt has a brief prepared comment, if you don't mind allowing him to speak, and then we'll be glad to answer any questions you might have.
Chairman Carroll, members of the committee, thank you for the opportunity to be here today. As Representative Johnson stated, my name is Doug Hoyt, and it's truly my privilege to have the opportunity to serve Wendell Foster as the CEO. For more than 75 years, Wendell Foster has served as a multi-service provider of disability support, offering more than 75,000 services annually to children and adults, including in our intermediate care facility and home and community-based services. I'm here today representing Andriana, Marcus, Valerie, and the other 60 people that have lived with their entire life with developmental and intellectual disabilities, predominantly cerebral palsy and autism. They range in age from 21 to 80 and are proud and thrilled to call Wendell Foster's ICF their home. Wendell Foster fulfills our mission of empowering people with disabilities to realize their dreams and potential with all of these incredible individuals. I'm also here today representing Phoebe, Lance, Carolyn, and the other 53 people that have also lived their entire life with similar developmental and intellectual disabilities. Today, none of them call Wendell Foster home. Rather, they have qualified to be and remain on our ICF waiting list. Our ICF is a residential option that allows people with intellectual and developmental disabilities their opportunity to live in the least restrictive environment possible while providing support for their complex medical needs. We want to add a small number of additional ICF beds in order to be able to support additional people. Today, the state health plan serves as a roadblock preventing us from accomplishing this. House Bill 334 will alleviate that roadblock and allow us the opportunity to submit an application for expansion of this service. Thank you for the opportunity to be here today.
So, Mr. Chairman, very basically, what we have here is two organizations, Cedar Lake and Wendell Foster, that are very much wanting to expand their ability to serve our communities and expand their abilities to serve those who are in the greatest need. We have that opportunity to do so, though. We need your support. We need your help. So, subject to any questions, I would ask for your yes vote so that we can help these fine facilities serve our community better.
Okay, gentlemen, thank you. Can you explain the difference a little bit between these facilities? And I know that there are several state beds that are vacant right now, and help me understand the relationship.
So as you mentioned, Chairman, there are several state facilities that have vacant beds. The capacities of those facilities are up in the hundreds. I understand that the individuals living currently in the state facilities are individuals with extremely complex needs who need to be supported in those services. Right now, Cedar Lake has 87 beds total, and Wendell Foster has 63 beds total. One additional point that we would like to make is that we are not interested in building a large facility. We're not interested in expanding on the large facilities that we have. We're looking at more like maybe a 4-bed or an 8-bed model that gets these folks into the community, whereas right now they don't have that ability. Cedar Lake currently offers, we operate 2 4-bed ICFs in a neighborhood outside of LaGrange, and without that funding, the ICF funding, those individuals otherwise would not be living in the community. They're in a regular neighborhood that you or I live in, and they're active in the community. So that's what we're looking to do is look at a 4-bed or 8-bed or smaller model and not expanding on the large facilities.
So this population is more of a population that would not be suited for FHP, adult foster care, due to medical needs?
Mr. Chairman, that is correct. The people that are served in the ICF at Wendell Foster have complex medical needs that require 24-hour nursing care and significant behavioral supports. Those are often not available and typically not available in a environment for an FHP or an SCL type environment. Excuse me. And that's one of the most significant differences.
Okay. Does anyone have questions of these gentlemen? We have someone to speak opposed to the bill. Okay, Jeff Edwards, if you would please approach the table. If you would, please introduce yourself for the record, and you have the floor, sir. Could you?
I'm sorry. I'm
please.
Jeff Edwards. I'm the director of the Kentucky Protection and Advocacy Division. And Senator Carroll, if I could, I'd like our legal director to join me at the table.
Yes, sir.
Thank you. Kentucky Protection and Advocacy is the state's disability rights organization. We have long commented on this process and have felt for a long time that if that the beds that we are talking about, when they were where they are now, in conjunction with the state health plan, they would stay in the community, or the state wanted to retain them, for small 4-bed ICFs, and that's what we think is the most appropriate. But also today, we're not standing in the way. If families have choices, and we want to respect the choices that families have, first and foremost. But we also want to bring up the 11,000 people that are on the waiting list for supports community living and the Michelle P. waiver that want services in the community. The Michelle P. waiver came about as a result of actions taken by our agency. We think this is an important action that the legislative branch can address. We think that nursing services have to be added and expanded to serve people in the most integrated setting that is of their choice. And that's what we are concerned about. I'm going to say again, people that want services in the community or in an ICF from Wendell Foster or Cedar Lake Lodge, we think that's appropriate. That's what families and individuals want. We're talking about the other 11,000 people that want services that we're not taking into account today. I'm going to ask Heidi to discuss those issues and the process that we've gone through and the number of people that could be served with the proposals.
Good morning. My name is, green light. Good morning. My name is Heidi Schisler Lanham. I'm the legal director at Protection and Advocacy, and I don't have a lot to add from what Mr. Edwards said. I've got some numbers. There are 632 ICF beds currently in Kentucky. Of those, 482 are public beds, considered public beds, Hazelwood, Outwood, those kind of places, and 150 or 151 are private beds. As of the last time that the long-term care numbers came out, there were 235 folks living in the public beds, so we're talking about 247 public beds that are open and that Cedar Lake Lodge or Wendell Foster would like to have. I would suggest that the state health plan as written does not keep that from happening. In fact, since 2008, every time that the state health plan is renewed, it's a 2-year health plan. We have commented on that, and we have wanted them to add language to keep the public beds from going to the private. And each time we have told, thank you for your comments. We want to keep all of our options open. We don't feel this piece of legislation is necessary. As you all are probably aware, Title II of the Americans with Disabilities Act requires states to provide services to folks with disabilities in the least restrictive environment, which is usually the community. The United States Supreme Court, in the case of Olmstead versus LC, that you've probably heard used a lot of times, said that the Title II does apply to the state and to persons with disabilities. So we have long argued that folks need to be living in the community. As Mr. Edwards said, there are 11,000 people on the 2 waiting lists currently. The cost for ICFMR care is Based on the latest numbers, public beds, $462,000. SCL costs about $93,000, so you could serve 5 individuals through SCL for the cost of an ICF. And the Michelle P. waiver, which has got all the same services as does SCL minus the residential piece, the average costs there are about $42,000, so you could serve 10 persons in the community on the Michelle P. waiver for the cost of an ICF. As Mr. Edwards said, you know, we would like to see nursing services added to both of the waivers. I think there have been task forces, and I forget whether it was the 2020 or 21 interim. There was a task force on services for persons with complex medical and behavioral needs, and we continue to argue that those services do need to be added to the existing waivers. I'm happy to answer any questions or to go into more detail. I know your all's time is short on a Monday. It's unusual to be here on a Monday.
Okay. So this gets a little complicated. And on the waiver side of it, I understand that. So you all are thinking more for SCL and Michelle P., perhaps more services like are provided within an adult day health care setting. Maybe have those the medical services within an ADT program, or accessible perhaps more to FHP. Has that been discussed with the waiver redesign that's been worked on continuously for numerous years now? Has there been any discussion about changing those waivers to add more medically related services?
That's a discussion that we have had. It has been a discussion, I think.
Continuously.
Well, yes, continuously. There's not anything that's been final, and we've been complaining about that for a while now, that we have been studying the rates and the process, and we have nothing done. And we have providers leaving the state. We have 11,000 people on a waiting list. If people could get nursing services, they could live in a 3-person home at times. They could live with a family home provider. There are people that would choose to stay home and live with family if they had those services and supports.
Okay. And I want to make sure the committee's aware of those 11,000, a little over 5,000 of those are actually kids, to kind of help put that in perspective. So I'm a little confused. In comparison to the state-owned facilities, obviously the Wendell Foster and the other home, Cedar Lake, that would be a less restrictive environment than the state facilities, correct?
Yes.
Okay.
And the parts of the bill, excuse me if I interrupted you.
Go ahead, you're good.
The parts of the bill that say that the additional beds need to be in a freestanding building on or off campus, we would suggest it needs to be off campus. And then we like that limited, just as Mr. Squires said, 4 to 8, so that you are actually in the community. We have seen pictures of, I think when they presented in the House Family and Children's Committee, they had brought pictures of what their what Cedar Lake Lodge's, I think it was their 4 or 8 bed, I forget which one it was, the 4-bedders were there. And it looks like the house in your neighborhood, my neighborhood, and that's the way it needs to be for these folks, not something on the campus of Cedar Lake Lodge or of Wendell Foster.
Okay, is that an option for you gentlemen to build off-site, off the campus?
Mr. Chairman, it is certainly one of those things that we want to have the opportunity to consider. What we have asked for, and the reason that the legislation is written as it is, to allow maximum flexibility and economic feasibility. Wendell Foster's campus is, in fact, in the community. Wendell Foster's campus includes a public park in the middle of the campus. When we talk about campus, it's not a hospital environment. It is truly in the heart of Owensboro. So we are just simply looking for options for both economic feasibility and what makes the most sense. When the costs are reflective, as presented a little while ago for the state ICF facility at in excess of $450,000 a year, Wendell Foster's rates are slightly in excess of $250,000 a year. And so there's a significant difference in cost. That cost goes up significantly the smaller the size and the farther it is from supportive services such as nursing and dietary and things of those natures. So the reason that we proposed the legislation as is was to allow flexibility for economic viability and flexibility so that we could locate property anywhere, whether it be adjacent to what Wendell Foster currently has, which includes ICF, SCL, and independent living homes, or whether it is someplace else in the community.
Senator Rocky Adams, you have a question, ma'am?
Yeah, just real quickly, just for clarification, and this is for P&A. So your testimony here, just so I'm clear, you're not opposed to this bill passing. Is your testimony just to further educate the committee members on other things that need attention in the future?
Yes, Senator.
Okay, thank you.
Senator Meredith, I know you have had some conversations about these issues. Do you have a comment to make?
I do, Mr. Chair, and thank you. Thank you all for your testimony. This is interesting dialogue that we're all in agreement, but we're not in agreement. And is this more of a fiscal policy consideration? You've given, some startling numbers here, and are you promoting the position that we can provide services to more people in a less cost restrictive manner?
Well, that's what SCL providers do every day. Is they are serving people.
That's what I'm asking.
Yeah.
So, if we expand the number of ICF beds, obviously going to take more resources. And you're saying those resources can be used to serve more people in an SCL environment. Is that what we're
They can, but
here?
at the same time, we're not. If people choosing to live in an ICF and receive services for an ICF, that's their choice. We want to promote the choice of the other 11,000 people on the waiting list.
I certainly understand that and appreciate that, and I know Senator Carroll and I have had numerous conversations about this over the years. That this waiting list is just absolutely inexcusable. It's atrocious, and I think we look for every opportunity to try to address this. And that's the root of this problem. It's not that they're asking for additional beds; it's that we can't service the population that we have now within the fiscal constraints that we have, and we need to find an address it some way. I think that's why he and I both were disturbed this summer when we identified maybe between $30 and $50 million from savings from single source PBM. We were very excited with the possibility that maybe that could be used to reduce the number of people on the waiver waiting list. But instead it was chosen to expand Medicaid benefits. And this population has been not just discriminated against, but literally abused when we have that kind of policies that do not address their fundamental needs. And we've got to do a much better job in this. And I think the answers are there if we'll be a little bit more aggressive and a little more thinking outside the box on what we have. But I appreciate your all's concerns, but it looks like we may be discriminating against one segment of our population to make sure we can provide services to another segment of our population. It's a very complex issue. I'm not chastising anyone, but we've got to have a better policy statement on this and how to address this going forward. And it's been kicked down the road too long, as you've mentioned. We've had study after study about this and really haven't come to any definitive solution to it. And the definitive solution is more dollars for these programs, which, again, every time we have an opportunity to save some money in one place, it should be dedicated to that. But I would hope and pray, and I know it's got very little to do with this bill, but I would hope and pray that we could set as an objective for ourselves that over the next decade we can totally eliminate this waiting list. It's not fair to these people.
One thing I would add is in the 2022-2023 budget, there are only 50 additional slots for each the SCL and the Michelle P. waiver. And obviously in 2024, you guys are going to be doing a new budget, and you could look at larger number of slots actually in the budget.
Well, again, I'm looking for numbers, and folks have heard me say I think this next budget cycle is going to be the most difficult maybe in my 7 years here because of inflation and the lack of federal funding that we're going to lose, and it's going to be a challenge. That's why, again, I was bitterly disappointed that when we identify savings such as the single source PBM that we can use to address these areas, we don't. Instead, we expand services for a population that has already received at least some degree of medical care, and we just have to do a better job.
And I think there is an effort with the children to look at them separate, and I know the cabinet's doing that right now. And if we can get that issue addressed, kids don't need as many, in most cases, need as many services as adults that are on the waiver. There are exceptions to that, but if we can get services established and get the children that are on that waiting list taken care of, then we can focus more on the adults. And I'm trying to think from the medical aspect of this, and obviously for adult day training, adding the healthcare component to that would not be that difficult at all. We have some crossover in our center as it is. If we have an ADT participant that needs some type of medical assistance, we have nurses in our adult day healthcare that can go over and check on that individual. In the family home provider, more of a home health setting and having those services, I could see that being a little bit more complicated. And then, if they were living at home, obviously it would be much like just home health coming by as needed. So depending on the severity of the health issues, it makes it more complicated, and I'm sure in some cases would not be a viable option that the ICF would be the best option for those individuals. So I get that. I really haven't heard much of the conversation about the healthcare component with the other waivers, and maybe that is something we need to take a look at as we continue to do the waiver redesigns in hopes that someday it's actually brought to a conclusion and we can take some movement on that. Are there any other questions? Okay. Madam Secretary, please call the roll. Oh, I'm sorry. Motion on the bill? We have a motion. Is there a second? We have a motion and a second. Madam Secretary, please call the roll.
Senator Rocky Adams, Senator Girdler, Senator Harper Angel, Senator Bledsoe, Senator Meredith.
Display my vote, please. I voted
Proceed.
aye, but I don't think this should go on consent because we need to have some dialogue on the floor about this, and appreciate y'all's testimony from both sides, and thank you for that input. Thank you, Mr. Chair.
Senator Tishner, Senator Webb, Senator Westerfield, Senator Wise.
Aye.
Chairman Carroll.
Aye. 7-0. On account of 7-0, House Bill 334 passes with favorable expression. I think we are going to leave it on the regular agenda. Representative Johnson, good work, sir. Thank you for bringing this bill forward. And gentleman, lady, thank you so much for the testimony. I think we all want the same thing, and every position, every waiver slot, every dollar is important, and that's why we're taking such a close look at this on how we spend those dollars. And as Senator Meredith said, we have a lot of work to do on this area, and it is our goal that before I leave this place to see that we no longer have a waiting list. And I know there are several that feel the same way that I do. And let's hope we can make some movement in that area. Thank you all very much.
Thank you all.
Okay, the final bill on the agenda is House Bill 387, an act related to reorganization, sponsored by Representative Samara Heverin. Welcome back. Please introduce yourself for the record, and you have the floor.
Long time no see. I am Samara Heveron. I'm still the state representative for the 18th district. Thank you. So House Bill 387, as you all know, Senate and House leadership both split the committees for Health and Family Services. We now have Health Services and Family and Children. And this would just do so during the interim. It would make that clear in statute. So we don't have all the chairmen fighting over meetings.
We have a motion and a second.
Second.
You'll get that, the names. Secretary would please call the roll.
Senator Rocky Adams. Senator Girdler. Senator Harper Angel. Senator Bledsoe. Senator Meredith. Senator Tishner. Senator Webb. Senator Westerfield. Senator Wise.
Aye.
Chairman Carroll.
Aye. On a count of 7-0, bill passes with favorable expression. We have a motion for consent. We have a second. All those in favor, please signify by saying aye. Opposed, no. Motion carries. Congratulations, Representative Heveron. Appreciate your work.
Thank you.
Okay, ladies and gentlemen, we will meet again in the morning. We have one bill on the agenda. If there are no other motion to adjourn, we stand adjourned.
It's gonna stop that.